I'm going to demonstrate how to insert a pump cannula for an Animas Vibe insulin pump. I'm going to make sure I've got clean hands and also ensure that I'm preparing it on a clean surface. I've got my cartridge, my inset to cannula, my insulin, and my pump, which is ready to be changed. Now you may find that you have a different coloured cannula, but to check you've got the right one, if you look on the paper backing, it just says inset to. So the first thing that I'm going to do is I'm going to rewind my pump. And to do that, I'm going to press OK to activate the home screen. Press OK again to go to the main menu, and then scroll down until Prime Rewind is highlighted. Then press OK. I'll then need to scroll up to highlight Rewind and press OK. So it gives you a reminder to disconnect the cannula from the body, which I've already done, but I'm just going to remove the old cartridge. I just need to unscrew the cartridge cap and pull the cartridge out, and then unscrew the tubing from the cartridge. I'm just going to place that to one side. I'm going to keep the black cartridge cap as we'll need that later. So now I'm going to open my cartridge packaging. So here I have my cartridge, my needle, my cartridge cap, and the blue handle which acts like a plunger. So the first thing I need to do is attach the needle to the syringe, screwing that on like that, and then the blue handle, which you need to push in and then twist round to make sure it's firmly in place. So first I need to depress the plunger and then pull it back to bring air back again into the chamber. And I need my insulin. So I'm going to take the needle cap off and, holding the insulin, insert the needle into the vial. Now I'm going to push down to push all of the air into the insulin vial, and I'm going to keep my thumb on there even though it feels like there's some pressure coming back. Then I'm going to invert the insulin and you'll see that it starts to fill automatically. So we're just going to pull back gently until the two black lines are at the bottom. Once that's filled, we're going to remove the insulin and place that back onto the table, and we're going to check for air bubbles. We can see one there, so we're just going to flick to make sure it rises to the top, and then gently push until you see drops of insulin at the end of the needle. Animas advise you to gently and carefully cover the needle before removing. So we'll do that and unscrew, and I'll just place that to one side to discard off safely later. So now we need to apply the cartridge cap to keep the end of the cartridge clean. I then need to remove the blue plunger handle. To do that, I'm going to squeeze on either side of the ridges and pull away, and I'm just going to place that there. The insulin can be kept out of the fridge for 1 month once it's been opened. So now I need my cannula, and you'll see that there's some tape around it, so we're just going to peel that off and peel that away. We also need to peel away the paper backing, so we just lift up the tab and peel that down. Now you'll see around the edges of the cannula we have some ridges and some indents. The ridges are to be held during all the preparation work, and the indents insert the cannula into the body. So holding the ridges, flip off this lid. So now I need to unwind the tubing. So I'm just going to clip that out of there and unwind that gently. Careful not to dislodge the cannula from the inserter. Now I need to attach the tubing to the cartridge, but first I need to put back my cartridge cap. So I'm just going to feed that with the small end onto the tubing. And then we take the cartridge, we can remove the cartridge cap, and then just twist the tubing into place. So now we're going to take our pump, and it will have timed out by this point. So we need to press OK to activate, and then press OK again to go down to the menu. Highlight prime rewind, press OK, and then highlight load cart and press OK. So at this point it reminds you again that you need to make sure that the cannula is disconnected from the body. So we're just going to place the cartridge into the pump and screw on the cartridge cap, making sure it's secure. And then we press select continue. And then the piston just comes up to meet the end of the cartridge. So the pump gives you another reminder that you need to make sure that you're disconnected from the body. So we can just press continue, and then it's going to take you to the prime menu. So now what the pump wants to do is to prime all of the air out of the tubing. And Animas asks for you to look for 5 drops of insulin. So to catch those 5 drops, we're going to place this here. We're going to hold the pump upright so that any air that is in the cartridge will come out, and I'm going to hold my cannula upside down so the insulin drops into the cannula cover. I'm going to press and hold go prime. So 1, 2, 3, 4, 5. So now I know that the cannula is primed and ready to use. So now we need to get the cannula ready to be inserted into the child. So we need to place the wire into the ridge here, remove the plastic covering, carefully remove the needle cover. Now this cannula works on a spring mechanism. You'll see that the white part here, if we pull down with 2 fingers until we hear a click, and that's the cannula ready to be inserted. The cannula can be inserted either into the tummy or into the buttocks. I'm going to demonstrate on Rue inserting it into the buttocks. So still holding the cannula by the ridges, I'm going to place the cannula onto the buttock with the tubing facing up, and we're going to press in on the indents to release the cannula. So 1, 2, 3. You'll hear that click, and then push gently. And then placing 1 finger on the tubing, carefully pull the cannula away. So we just need to make sure this is stuck down properly by running our fingers over there. So now we need to fill the cannula. Because we've taken the needle out of the cannula, that's left a tiny bit of air. So we need to take the pump and press OK, because it will have timed out, to wake it up again, and go back down to prime rewind, press OK, and then fill cannula will be highlighted. Press OK. There are 2 types of cannula that Animas provide, either a 6mm, which requires a 0.3 unit fill, or a 9mm, which requires a 0.5 unit fill. We're using a 6mm cannula, so we just need to scroll up to select 0.3, press OK to confirm, press go, and then that's your cannula primed. So now that Rue's gone off to play, in 1 to 2 hours, you'll need to check the blood glucose level. If it starts to rise, this could be an indication that the cannula isn't working properly. The final thing that I need to do is to discard of my sharps. The first thing that needs to go into the sharps bin is the needle from the cartridge, and also the cannula. Now the cannula is 2 parts, and it's just the white part that needs to go into the sharps bin. So to separate those 2 parts, you need to push here, and this will separate them. And then you can pop that into the sharps bin. and this can go into the recycling. And that's how to insert an Animas Vibe pump cannula.